All about the eyes in today's HealthCast. Local 10's medical specialist Christy Kruger has details on a breakthrough study right here in South Florida and ways to deal with a pesky eye problem.
Yeah, very interesting, and it is right here in South Florida, which is awesome. Ocular melanoma is the most common cancer of the eye, and in about 50% of the patients, it can metastasize and go right to the liver. But Dr. William Harbour with Sylvester Comprehensive Cancer Center invented the first genetic test to kind of classify ocular melanoma as either type 1 when you're lower risk or type 2 at a high risk. His latest findings uncovered a biomarker that could really help guide treatment options for patients with this newly discovered subset of the disease.
Now, this has several important implications for patients. Number one, we can identify those patients that need more intensive surveillance than we ordinarily give the class 1 patients. So we need to watch them a little bit more frequently based on this information. Also, it's not enough just to monitor the liver, because we know in this subgroup that about half of them that do metastasize will not involve the liver. So we have to also look at other parts of the body.
So one size does not fit all. Also in today's HealthCast, dealing with a really pesky problem most of us have faced more than once, that irritating eye twitch. You've seen it before, right? Vision specialists say that reducing stress, getting enough rest, avoiding caffeine, and moisturizing eye drops, well, you know what? All of those things can really help.
If it's more than a few days and it's really bothering you, or if you are having other symptoms, if you notice that your eyes are starting to feel red, or it feels like there's something in your eye, or you're getting light sensitive, or your vision is changing, those are all signs that maybe you should get evaluated and see if there's something else going on.
You know what, for me, it's always stress. Well, when it comes to children, though, the doctor says if you notice your child is blinking frequently or their eye is twitching a lot, it's always just a great idea to bring them in for an evaluation, because they can't always tell you if something is really wrong with them. And that's today's HealthCast. Have a great weekend.
Okay, you too, Christy. Thank you. A real life